the healthcare data is highly unstructured data. Thanks to a lot of technology development in last 10 years. See, the way we are able to relate to imaging today was very, very different 10 years before. Any image can be interpreted in a right manner today. The technology is available. And any communication can be brought into a digitized structured data model, even if it is unstructured. Just to give an example, similar diseases, kind of a same diagnosis and prognosis, same prescription, but the communication of the doctor to the individual patients are very different. These kind of a subtle differences healthcare poses. So ability to catch this data is the first technology intervention is necessary for India. Because to AI to play a role, not just an EHR standardized data, which is given by FHIR standard, ICD-10 and ACC and HIPAA are similar what we are doing in India, and all of it is fine, but that is gives you certain amounts of hygiene. The most critical point is how are we going to capture this data? Now let me give you a little more detail what I mean by this data important. Every health professionals, every senior physician in whatever specialization they are practicing, all of them are clear about the care plan, protocol, care pathways. But it becomes a very static model based on their medical practice. But the biggest difference patient to patient on the ground, it is going to come on the data. The data could be a parameter or a diagnostic test results or a physical consultation or a physical examination, whatever way all this data is coming in. I'll just give you a simple veracity of this data variation. Now, if you look at in obesity, it is close to about 1,600 different attributes has to be considered. If you take diabetes, about 1,300 attributes has to be considered, and at least minimum about 70 to 80 data point has to be considered before you give a treatment. In oncology, it's very complicated. It is about 3,300 data points. Now, the ability to capture these indicators or attributes into the system gives you a phenomenal power for AI to act. So my suggestion is to really scale the technology development which has happened in last 10, 12 years is highly relevant for healthcare. It is time to act, and ability to capture this data is critical. India is in a right vantage point to really implement this system. I certainly believe that the new Digital India Health Mission and the various digital transformation which are looking at healthcare will pave way to collect this data.